Rachel. I'm one of the registered nurses in this community health center. Can you confirm your full name, please?
My name is John Smith.
How may I address you?
You can call me John.
Okay, so John, your doctor has referred you for further advice regarding your recent diagnosis of anemia. Do you have any questions regarding your diagnosis?
I'm really confused by the diagnosis. I always try to eat vegetarian ready meals because I believe they are healthy. And so I can't relate why this anemia, and I just can't relate this diagnosis to my diet.
Okay, John, I see. So, this iron is usually sourced only from the diet you take, and it can be low in vegetarians if there is no proper diet planning. But let me reassure you that it is treatable with proper dietary modifications. Could you please tell me about your dietary habits?
Well, I have coffee for breakfast, frozen meals for lunch, and for my afternoon tea, I usually take coffee and cake. I rarely eat dinner.
Okay, so far we have discussed your diet pattern. Now I will suggest some ways in which you can increase your iron intake. Firstly, you should include beans, tofu, and iron fortified cereals. Green leafy vegetables such as spinach or kale are also rich in iron. Am I so far clear?
But I
Yes.
don't like tofu and green leafy vegetables.
It must be hard for you initially, but you can try these gradually, which is really needed to treat your anemia. And also, try to reduce your coffee consumption because it inhibits absorption of iron.
I don't think I can reduce coffee. It helps to cope with the stress of my work.
If you can't reduce coffee consumption, it will be beneficial if you allow 1 hour between consuming iron rich food and coffee. This will increase iron absorption. So, all these are really essential to treat your anemia. So, try to follow these instructions, please. Are you following what I am explaining?
Yes, I have understood what you have explained. Yeah.
Okay, Joppa. So, to go over what we have discussed, your doctor has referred you to get further advice regarding managing anemia and the dietary suggestions. As I have explained, try to include more iron rich diet and also to reduce your coffee consumption, or at least allow 1 hour between the intake of iron rich diet and coffee. Do you
Okay, I will try to include some of those iron-rich diet, but I just can't reduce my coffee consumption.
have any further concerns?
No, I'm okay, thank you. Thank
Good. Nice to see you, John. Thank you and take care.
you.